throw around a lot of different terms, first degree, second degree, third degree, so I want to just briefly go over those terms so that we're all know exactly what type of burns we're talking about. Well, first of all, most of the burns that pediatric patients have are while they're at play and also at home. In the adults, many of the burns happen at work. So the majority of burns that you encounter with children will be at the home, so safeguarding your home is a major task for you. Now this is sort of a schematic of normal skin. From our standpoint, the skin has two layers. The green and yellow is one layer, that's the top layer, that's the epidermis. And then most of the skin is what's called the dermis. If you have a burn to this top layer, that's a first degree burn. Once you have a burn through the top layer and into the middle layer, that's called a second degree burn. And if you have a burn through all the layers of the skin, both the top layer and the second layer, that's called a third degree burn. And that's extending down into this yellow layer, which is the fat underneath. So again, a first degree burn is a burn where you have some redness. Once you see a blister, that's a second degree burn. And if you burn through all the layers of the skin, that's a third degree burn. Most burns that we see are second degree burns. And this is an example of a second degree burn. This is an arm, this is a blister, and this is a blister that's been opened. So that's a second degree burn. Again, second degree burn, blister. Another type of, and these were examples of skull burns. Another type of burn that we see are what's called contact burns. And you can see that this is a child's arm, and you can see definitely a pattern of an iron. The child is come into contact with an iron. So that's a second degree contact burn. A different type of contact burn, again, we see the pattern of a radiator perhaps. And the same. So in contact burns, we often see the pattern of the hot object. Now, electrical injuries, obviously this is an extreme example. If you get hit by this amount of lightning, you probably will not survive. Most of our electrical injuries are more like this. Child, unsupervised, curious, and gets involved with the electrical outlet. Whenever we see a child comes in with a history, a story that they've put some type of object into the outlet, one of the main things we look for is whether or not the heart has been damaged. The heart is an electrical organ. We obviously look at the hand to see if there are any cutaneous or any skin changes, but more importantly than that, we make sure that the heart's okay. We take EKGs, we do blood work, we do monitoring, we get the cardiologist involved if need be. So don't think just because you don't see any skin burn that the child's okay. You must bring that child into a hospital to be monitored, usually for at least 24 hours. Just as was said, you have to make sure that any of the cleaning devices that you don't put it into a soda, because the child may not know and think it's a regular soda and drink it. But we also have to make sure that any of the detergents or any of the acids or alkalis that we use for cleanings. The main thing you have to remember with chemical burns is irrigation. When we have a chemical burn, we'll irrigate that burn for at least 2 hours. You should start irrigating right away. After 2 hours, if the person still has burning, we irrigate some more. So irrigation, irrigation, irrigation is the key to treating chemical burns. Another type of injury that we see more commonly now are friction burns from treadmills. A lot of families are into exercising. You have a treadmill, the child is curious, they hit the treadmill button, the treadmill comes on, and they get a friction burn. Treadmill burns often happen on the hand. I've seen them on the feet, and they're usually very deep. I've seen one treadmill burn of the hand where, because of the rotation, there was a fracture also. So in addition to the burn, the child also had a fracture of the fingers. And this is an example of the treadmill burn that's healed, but you can see scarring and decreased range of motion. Sometimes we have to go back to surgery and cut this scar so that the child can move the hand well. One thing that we see in the summertime is children running around on a playground or at the beach. The sand is very hot, they don't have shoes on, or someone who's been cooking at a beach and puts a little sand over it, but the coals are still hot, and an unsuspecting adult or child comes and gets a burn to the foot. So we have to make sure that in the summertime to check the pavement to make sure that it's not too hot when our children are running around.